Welcome to Nurse Rants. This is the third video in the series regarding skin infestation with scabies. We've covered in the other two videos some basic information. Scabies is a rash that doesn't go away, that spreads through different parts of your body and may be spread and very contagious through close contact with linens, surfaces like your car seats, and also skin to skin. You can't spread scabies through a handshake, but you can through close, intimate contact like sexual activity. A couple of things that we want to talk about in this last video segment is how to know when your scabies are really gone. They say from all the literature that I have gathered and read that 14 days without any new scabies bites or lesions, which is very difficult to tell because there is something called post-scabies. After you've been treated with all these different substances like permethrin and neem oil and sulfur and urax, after you've treated topically, your skin is very raw, especially if you've been doing anything like bleach baths, and it's also very dry. So you will have a lot of irritation and maybe even some allergic reaction. It's very difficult to tell if those areas that are itchy and new lumps are actually new scabies bites. They're not actually bites, they're areas of inflammation from the scabies being under your skin. My go-to way to tell was whether or not they were in the skin folds of your wrists and in your fingers. You'll be able to tell. You don't usually get rashes or allergy on your fingers. So any new bites within 2 to 4 days, will let you know on your hands and wrists that you most likely have been reinfected. So let's summarize. Your inflammation of your skin may be due to a mite called scabies. Scabies is contagious for people living in the same household. It can be transmitted in the fur of a pet. Scabies cannot live within your pet, but if your pets go from bed to bed, the little mites and nymphs may be carried on their fur. You need to make your environment very, very basic. Things that you can wipe down with rubbing alcohol, Lysol, or Clorox. You also need to wipe down things like glasses. Put your items aside. If you cannot put them in a dryer, you need to put them in plastic bags, and I recommend leaving them in bags for 7 to 10 days. Scabies take about 3 to 4 weeks to show. So if you have a roommate or someone that says, hey, I have scabies, you've been in contact, it's best to treat prophylactically with permethrin or a topical agent. And then be very, very careful about what it is that you touch in your environment. I would sterilize everything because it is a bug. Rubbing alcohol does kill it as well as Clorox. So I want to say that 14 days is the amount of time that you should be bite-free to know that you are cured. But again, there is something called post-scabies syndrome, in which the skin is very irritated and lumpy. I do recommend treating for at least 4 to 5 weeks after your initial diagnosis of scabies, and to keep your environment really clean, especially with plastic on your chairs, computer area, and wiping down things like phone and glasses. I hope that this video has been helpful to you. I hope that you will ask questions and subscribe, I wish you the very best in your journey. There is hope for people with scabies. So don't give up, keep your environment clean, and keep treating.